I would like to introduce my guest this afternoon. I brought with me, again, we're talking about the business of healthcare, and what we've got going on here is I like to bring in different people who can bring to your attention. Now, if you're a patient, I guarantee you are totally not aware of all these crappy little things that go on behind the scenes, all the different kinds of things that your doctor has to worry about besides seeing you and trying to figure out what's wrong with you and fix you. So I bring people in and we talk about some of these different things. And today I have got a data specialist with me. So I would like to introduce Mr. Peter Rabolt. And Peter, welcome to WSB.
Thank you. I like the opportunity to be here and visit with you.
So I'm going to have to ask you to do your little introduction thing because I was actually out on the road and with a client before I came here, and I just don't I don't have it printed out.
No problem. Again, I'm the co-founder and part owner of Synchronized Systems, which is the technology company that relates to the medical community when it comes to software or services, electronic transactions, which is really an interesting area these days. As you said, everything goes on in the background. The doctor is so interested in the patient, but he has 1,000 other things to deal with, and that's where I help them out. I've been doing this now for 3 decades, and I've been involved in from the very beginning when everything was handwritten to where now it's all electronic transactions and how everything has become real time. And it's just an amazing thing. I love what I do. I love helping people with this, and it just moves forward.
So why don't you tell us a little bit about your background? How did you wind up? You're local here on Long Island, right?
Yeah, I'm a New Yorker. I was born in Brooklyn, and from Brooklyn moved to Queens, city boy. And from there in Queens is where I went to Christ the King High School there, and that was my first opportunity to get interested in this thing called a computer. I had no idea really what it was, but it just seemed interesting that you could do something with it. You could make it do things. So in high school, actually, they didn't have any programming courses, but I learned enough to know this is something I wanted to do and that I wanted to do it for myself. So very quickly, I came to 3 things, which was I told my guidance counselor at 16, I want to run a business, I want to do computers, but somehow in that, I want to help people. And I don't know how it's all going to turn out, but these are the 3 things at 16 that I had thought of. And slowly but surely, it worked its way out. From there, I went to Pace University in Manhattan, and they had a great program there. Actually, they had 2 programs. They had a CIS, computer science, which was more theory, versus MIS, management information systems, which was more hands-on. And I easily knew I wanted to be hands-on. So at Pace, I learned a lot about programming, but they had additional things in the MIS program that were great. They gave you some business management, accounting, law, economics. And really interesting that 30 years ago, I never realized, as running a business now, how much of that I would lean on. The programming is just one thing. But running a business and helping people, you sometimes depend on all the other things. So once I came out of Pace University, right away I started looking for a job, and through the blessing of the Lord, 3 weeks later, somebody contacted me out in Babylon. So I worked my way to Nassau, and from Nassau I drove out to Babylon and worked for a company there. It was a software medical company. And the reason they were interested is part of my resume. When I was back in high school, and I knew I wanted to do this computer thing, my mom and I visited my brother out in California. He worked for IBM. He was a scientist. And what he was doing there was they were trying to push the envelope with laser light and such to try to make things go faster. And to do that, they did a lot of experiments on plastics and polymers. And in doing that, they used this thing called a computer. So when I was there, I said, what is this? And it was so interesting to me how he ran these things called programs.
When was that? What year was that?
That was about 1977. And at that time, it was just starting. People started to know about Apple Computer and Steve Jobs, and they were making their computers in the garage. And so it was really interesting to me. And my brother could tell how I was infatuated with this. So when I returned back to New York, he said to my mother, we really need to get him a computer. And so at the time, there were only a couple selections, and Radio Shack was one of the bigger ones. So they got me this thing, and I went to town on it. I learned everything I could. In fact, within a few weeks, I had written software. I just thought, well, if we're going to keep information, I need to keep things like names and addresses. So I wrote this little program I called Record Access System. I had no idea what I was doing, but it kept names and addresses. And suddenly my neighbor said, wow, this is really cool. Can I buy that?
How old were you when you were doing this?
Probably about 17 at the time.
Goodness.
So I sold my first piece of software for $50 to them.
And
that
what
they
were
kept
they
their name
using
and
it
address.
for?
Well, they had a business, and they wanted to keep clients in the business. And they found it that I did something like you could search by name. You know, I was just learning, but I thought, wow, this is really an interesting thing. And it turned out for them that rather than looking through lists of paper, they just went to their computer, typed it in, and they brought up the name, address, phone number, things like that. So that led me into an area. That was a game changer. Because once I did that, I realized this is where I want to be. And this helped me get along to that 3 weeks out of college job where I was going to do programming. And I came into a small company in Babylon. And they did medical software. Well, they were just starting out to do medical software. And I was like, what is this? I have no idea what they're doing.
So now, was it clinical or or business software?
Well, what they started out, because at that point, all the claims and things that the doctor sent in were handwritten. And there were obviously issues with that. You had to have somebody who wrote well, or you would make a mistake, wouldn't realize it, you send it in, and then it gets rejected. So their idea was, on an Apple computer, they should be able to write some kind of software. Actually looked like the form. We designed the form on the screen to look like the paper. And so they could fill it in, they could review it. This way there would be less mistakes, less issues, and then they printed it out. So that was step one. We went through many iterations of that, eventually keeping the files themselves in what we call a database, which basically keeps all the claims, and they could print it in a batch. So that was the next level. And meanwhile, they're picking up doctors and dentists and ophthalmic and pharmacy. So in a weird way, I was exposed to all the areas that I deal with now, but didn't realize back then that it was going to be so crucial now.
I'm going to tell you something. So I have a very interesting story where I was probably around the same time. So I was a work-study student at the College of Insurance, and my sponsor, that's what they called them, was Metropolitan Life. And I was working on the brand new, exciting group claim system. And I was working on the receiving end of what you were doing, because that was exactly what would happen. We would get these claim forms in. I mean, I was a business systems analyst, so I wasn't actually getting the claims. I was the one who was helping fix things in the computer.
Right.
And I was the translator between the users and the systems people, trying to translate to them, to make the computer work better for them. But that was one of the big things, was when we started to receive electronically generated claim forms, it was a big deal. So I was
involved.
We were in the cutting edge coming on of computers in this industry around the same time.
Because I felt there was going to be a revolution. I could feel it coming. Handwritten to the printing, then saving the data and printing. Then the next step level they did is they connected with New York State, and they had an opportunity. They said, well, instead of printing forms, why don't we put this on this relatively new media called a floppy disk? And for that time, for those who don't know, a floppy disk was literally a floppy little piece of media that would go in the computer, and you could write data to it. So instead of now we used to send out FedEx these boxes of forms that were filled out to the state for processing. Now you could put it all on a little 8-inch floppy disk, put it in a package, and send it to the state. They made a connection so that on the state level, they provided them computers so they could interpret or translate the data off of the floppy disk, and it would go into their mainframe. And then this way there was less and less of keying mistakes, keying data, that type of thing. So it's really how it progressed to that floppy disk point was where I saw the revolution of this, and that it was going to move forward, and that this is what I wanted to do for the rest of my life. So in working with them, it took a while to understand all the different facets of what was going on. And unfortunately, there were some issues with that company, and I learned from them in a real way what's the positives and negatives of running your own business. And therefore, I had an opportunity at one point to leave there and try my own enterprise with a business partner of mine. And that's how we created Synchronized Systems. We're now into 1988. And so we started brand new at that time, but we had this experience of not only developing software, but the billing experience to be an expert on the other end. So I started to call it a hybrid company because we did the software, which some people do traditionally, and we had the expertise on billing, which some people do as a billing company, but we kind of did both. And we married together the ideas, and we started from there to get our own clients and move forward.
So you guys have been doing this for almost 30 years.
Yeah, kind of scary that it's that long, but that's absolutely true.
Well, you started so young. Are you going to do anything special for your 30th anniversary celebration?
I don't know. I mean,
you should.
Yeah, I really should. People have talked about it, but
okay, good. I'm going to help make sure that happens.
My nose in the books of what I do. I love what I do, and obviously taking care of my family and all. So I run around busy like that, but it's not always about, sometimes I tell people, they say, wow, you were a genius in figuring out what you're going to do. Well, honestly, I didn't figure anything out. It's just a path, and I followed a path, and I got to a point. I had some initial ideas of what I wanted to do, and it worked out for me.
Yeah, I've had the opportunity to work with you on a number of projects, and I think I've told you this before. I'm not the technical person myself, but I know a technical genius when I see one, and that ability to take somebody else's scatterbrained idea and go, however you would do that.
Right.
I'm trying to get the sound effect.
Yep.
Tap on the keyboards and make it happen and turn it into something, and all of a sudden you have a result of something that it would have either taken you a long time to do it manually, or helps you see something in a different way. Or for me, the most powerful thing that I've seen that you do is you're able to create an interface between something on like a doctor's computer system and the insurance company's computer system, and make them talk to each other like they wouldn't otherwise.
Right. It is a certain creative process. And when I was younger, one of the things I wanted to do on a side point is I also wanted to be an animator. So I was going to be computer guy and animator guy, and I was going to work for Walt Disney. But that never worked out because I never had that talent. But the creative part of it still was with me. And what I found in the computer was another way to use that creative element and be able to go forward with that, help people, which I do every day, so that fits that, and running my own business. So it all came together when we were writing billing systems. When we became our own company, we created billing systems for each modality. In fact, when I was half my age, I was able to write 9 systems, full systems, in 2 years, which is almost impossible. I can't even imagine that now. But it's just, you knew what you wanted to do, how you wanted to do it, and you just pull forward, and the business took off.
Well, I think the interfaces the systems on the other side were less complex at the time, too.
Yes.
So that made it less complicated, too.
True.
So, we've been talking about a lot of theoretical things. Let's talk about some specific examples so that people can maybe envision what is the practical use for some of these things, something that a patient might relate to. And then what is the miracle of the big bang for the buck that a provider gets out of these things. Because I can't tell you how many times I go into a provider's office. I'll give you an example. Mary works at a provider's office. Her job all day long is to call and verify eligibility.
Right.
For the patients that are coming in tomorrow.
Right.
So that we can make sure that everybody's insurance is still valid.
Right. And how that moved forward, let me just step back for a little bit, because the billing systems were a critical element at the time. But then all of a sudden, another game changer in life, 2003, we have HIPAA. Now, HIPAA obviously is for privacy and security of patients and information. But the other end of that was that before that, each billing system was unique, usually proprietary to that state. So if you build Medicaid in New York, it may not have been exactly the same as billing Medicaid in California. When HIPAA came out, they decided to concentrate on a federal mandate that brought along EDI. Basically, EDI is an electronic format that is now federally mandated for everyone to use. So that was a game changer, because we were worried at the time. You knew what you knew before. All of a sudden, there's a brand new thing you have to pick up, and you have providers that are, depending on you, and the percentage of payment rates had to continue the way it was. So from there, once EDI came out, that also had to do with electronic transactions. Slowly but surely, we moved from media, like a floppy disk, or sending it through a batch. We were now able to use electronics through the internet securely to be able to submit information more and more real time, so that we were able to get information back. So we, as in your example, Mary, all of a sudden now I come to Mary and say, well, you can put your data into a Excel file from the night before, dump it from your practice management system, put it into our system, it loads in, we set it up for, say, 2 o'clock in the morning. It does an automatic send, receive to the state, and in the morning, they have those results in minutes. So this was a game changer, especially for places like methadone clinics. They love us, because the nurses come in 6 a.m., there's the data. They don't have to worry about phone calls, don't have to worry about that, and they can run this every day.
They don't have to worry about the patient that comes in and says, oh, I lost my insurance card, or they don't have any of those kinds of problems.
Yeah, I mean, even situations that do come up, if they have people walk off the street now, a lot of them are using the medical cards. They can scan them or put them through the slide card system, which in turn reads the information, connects to the state, and does a real-time transaction now to give them the results right away. But again, the phone was a critical element at the time, but very intensive, where now that's been taken away by an electronic transaction, which gives you results back in minutes.
And I think providers use that kind of process improvement, that's what I would call it at its most basic, that kind of process improvement to either have less staff, right? If Mary doesn't have to sit on the phone all day and make boring phone calls, maybe she isn't needed at the office, or maybe we can put her brain to better use, doing something more productive.
Oh, absolutely. And as you said, it helps the doctor's offices be more efficient. This from 2003 had gone forward, where now, I said, in a lot of cases we're doing real-time things, which means results in seconds. You know, when you go to the doctor's office, or let's use the case of the hospital, you go to the emergency room and you see a doctor there. When they take your demographic or admission information, that information is going real time to a HIS, which would be a hospital information system. The doctor comes and sees you, and now say he wants lab work or he wants radiology work. They then send those requests immediately through the system. It's received on the radiology side or the lab side, and the phlebotomist, or in case the imaging people come and they take things like that. Years ago, that was all on paper. But those transactions that go from point A to point B, they have to be translated, they have to be communicated, the results on the other side have to come back. That middle point is where I fit in. Often clinics, hospitals, day treatment centers, All of those people use information that has to be translated through a piece of software to go to the EDI format, submitted to some entity, and then the return back and exported out again.
My guest today on the business of healthcare with Habanero here at WUSB Stony Brook is Peter Rabolt, and Peter is the president of Synchronized Systems, and they are a local company located right here in Patchogue. And you actually have some other stories about how electronic transactions behind the scenes can be leveraged and translated to really make a difference in a practice or a hospital's world, right? All their work events, all their money, everything that they have to do. And I think you had another example, right, that we were going to talk about?
Yeah. So what happens often is that in this EDI world that we talk about, there are 13, sometimes more, but 13 specific transactions that I concentrate on. They all come from when the patient comes in. The doctor needs to make sure the patient is eligible. So there's an eligibility transaction.
There's two, actually. There's a request and a response, right?
Right, and a response, right. So we provide translation software that gives them an easy way to batch this stuff and move forward. And there's, sending the claim itself, which is submitting that to the payer. Sometimes there's authorizations in between. We can do software for that. But the process coming through, one of the problems that many providers have, and again, I come across people because I get referred. I'm very lucky in this case. I don't really do too much marketing. I more get referrals because when people are happy, often they talk to others in the same area and say, you should talk to Peter or that type of thing. So one of the areas was some of the larger places, they submit their claims and they get back, again, there's another electronic transaction. It's a payment file, and that gives you information. Rather than waiting for paper like they used to years ago, they can get a payment file back electronically that explains, again, whether they were paid, denied for particular claims, and that goes back into the practice management system. The problem is the timing of that, because more and more states now have, payers, and states have reduced the amount of time that you can wait to submit a rebill or a denial of a claim. If you have a mistake, you need to correct it and send it back. So some of the larger places have issues with the data not coming directly to them because it's a bureaucracy. So it takes time to go through the different avenues to get finally to the person who needs to deal with it. One of the conditions or situations I came across was with Stony Brook Hospital, in fact, their billing arm. And the billing company submitted the claims and all, but they weren't getting the payment information timely enough.
Actually, it wasn't just payment, it was adjudication, right?
Yes, adjudication was one thing. Payments, though, now the state has brought it to a 60-day 60-day limit of being able to correct things and resend them back out. Otherwise, the claim is lost. And depending on the process, some people have a simple payment process. Some people, it's more involved. So what was happening to Stony Brook was that they, in fact, were getting the information on a later point, maybe only a week or two before the actual deadline limit. And so I discussed with them one of the things I think about, because in creating the software, again, you start with an empty option and you can build it into whatever you want here. So typically, instead of just sending claims and waiting for the payments, there's another EDI transaction called a claim status. And typically people use that, if they do, to find out the status of claims. They might use it after the fact, historically. But I quickly realized, and this is part of what I do, is that you morph A and B into C. You come up with a new solution. So what happened here is by using the claim status as a tool within 24 to 48 hours after submitting the claims, you could actually get the same data back that you'll be getting back in 5 and 6 weeks from now. But it gives you the option now to work on it prior to actually getting that 835 back and make those corrections.
Right. So I like a real life example of that. So people might sit there and say, why would it take so long to get an answer back, especially in this day and age of all this technology? Well, one of the big reasons is that part of a fiscal balancing or budgetary considerations. A lot of insurance, none of the commercial payers do this, but the government payers say, you know what, we get the claim today and we know if we're going to pay it or we're not going to pay it, but we're holding it for a couple of weeks and we're not going to release the payment
Correct.
For a couple of weeks. I think Medicare is 3 weeks, and I think Medicaid might even be a little bit longer.
Yeah.
So what happens is a lot of places, a lot of practices, or as you say, institutions, aren't geared up to worry about it or to process it until it comes back electronically and they can reconcile the whole thing. So that's, now if all you do, one of the things that you can do that your service provides that's great is I can say, whew, I don't have to worry about this claim because I know it's going to be paid and I just have to sit and wait for the check. The real issue comes in, and I think where the big help comes of the service that you talked about where you're checking the status beforehand, is you can find out if they're going to deny it for some reason. So let's just say they deny it because the person isn't eligible. Well, then you have to then figure out, okay, if this isn't the right payer, who is the right payer?
Right.
So that's one of the kinds of things. Maybe it wasn't formatted. Maybe the bill wasn't submitted correctly and it needs to be a code needs to be done differently, or maybe they put the wrong provider on or something. Those the same thing. That gives them an opportunity to not have to wait all that time to get the what we would consider an EOB, right? As patients, we get a copy of the EOB
Right.
or the explanation of benefits in the mail after our doctor or hospital has submitted the claim. Well, instead of having to wait for that to come back, it's great from a process and also a cash flow perspective if you can do that. So let's just say, okay, I know my payment isn't coming for 3 weeks. That defines my cash flow. I can identify all of those and say, I know that 3 weeks from now I'm going to get a check for a certain amount of money from Medicare or Medicaid. For other claims that aren't being paid, it allows me to be able to start working on, okay, how am I going to get this one paid?
Right. And it's absolute that, especially these days, I mean, it always happened before. People always followed up on their denials, but more and more, maybe with more regulations, more situations, more financial situations, it's more and more critical to be able to follow up on those denials quickly and get them back out the door. And especially now that states are limiting the time that you have to do that. So being able to provide a solution like this, somewhat simple, but yet the effect of it is amazing to the provider, because now they can start working on these things early, and then they can start rebilling them. They don't have to wait for the payment file to actually come back because they know this is the same information in a different form. But they use that information to their advantage and to be able to move forward. So many of the solutions that I create will combine EDI transactions for the advantage of the client. And I think that's what makes it unique. I used to think knowing how to do this thing called EDI was the key. But I learned it's not what you do, it's how you do it. And that's what makes me the EDI doctor, as someone has called me. I love that. I absolutely love that. Different. So I don't have to worry. In fact, I've trained others from other companies how to handle EDI transactions. And unfortunately, even with the best training, they have failed with it. So often what people do is they'll say, you know what, I'll just buy a solution from someone else. It's only this one targeted thing. We're not asking you to replace your entire practice management system. We're just filling in a part that either A, that practice management system may not do well, or B, maybe the training didn't work out, and somebody who used to do that, do the finances and all, it's now lumped into an administrator's hands who has no idea what to do with it, but they need to do this feature. And so now they'll ask others in the community, which might reach out and say, well, why don't you give Peter a call and we have a chat about it? And then they realize that, you know what, it's not just a piece of software. I don't give software and walk away. You get the whole package with it. So you get my experience, my concerns. Sometimes I can educate people on what I know about it. Or if we talk and have a good conversation, sometimes something new comes out of that.
Well, you also, the other thing that I've seen that you do is you identify problems. You have identified problems either on the provider or the clinic side where they're not doing something correctly, and that is what is preventing them from either getting a payment or being able to provide the right service to their patients. Or you've also identified problems on the payer side, and right, because of the way that you're able to uniquely look at the data.
Well, yeah. In the case of being the EDI guy in this case, I have to really get granular with the information that often a practice is not going to get to. So the idea of having an expert that's able to help them in that, and I used to sell the software and provide all the support and the education, like I said, but more and more what people were asking was, can you do this for me? And I never really pushed into that area as being a billing company, yet I had the ability with me and my team to do that. So very recently, within the last 2 years, that was another evolution where we've taken on some project management for clients and being able to do the electronic side of it for them and provide results that now they can use analytically, to be able to now see trends and situations that are happening where before maybe they didn't look at the data that way. So it's, again, another evolution, as I said, from the EDI guy to the EDI doctor and where that fits in with this. But I have to tell you, I love it, and I have a ball doing it. And it all comes back to my core things of a new business, running my own business, being with the computer, and most importantly, my connection in the big wheel to that patient that's sitting in the hospital bed. Because without what I do, that never, I'm one piece in that big thing. So to help people, I'm doing exactly that.
In using your skill set.
Yes, using my skill set, which typically would not be connected to a patient.
Right.
But, my thing of continuance of care and how that sometimes falls apart. I've been in situations, my wife's been in the hospital for a few things, my daughter, and it knows you go from the hospital to the nursing home, say, for PT or something, and the information should be passed over 100%, you would consider. But sometimes they get to the nursing home, and they're like a new patient. Why? Because maybe the paperwork didn't make it across or whatever. So my part in this is continuance of care, that from the hospital electronically, information is passed over to the nursing home, so they now know you as a patient before you even get there. And so I'm a proponent of that in the finality of whatever's best for the patient to recover quicker, to get the right medications and what they need to do to come out of it. So.
Excellent. So my guest today has been Peter Rabolt. Peter is with Synchronized Solutions, and they do all kinds of this behind the scenes electronic transaction stuff that you, the patient, might not even be aware of. Some of the crazy things that your providers need to do to be able to get paid for the services that they perform. And the same thing with providers. How many providers still have somebody calling on the phone to check the status of a claim? Or
yes, absolutely,
or authorizations, right? Authorizations is another big one.
Crazy now, yes. Mm-hmm. And we're trying in situations, we've had some in durable medical equipment, they need authorizations and such, and we've been able to automate some of that where, in a large DME store or situation, they could be doing 1,000 in a few days. And in order to, like you said, the intensity of contacting and getting those numbers, where sometimes if you can do it through a batch, I always call it in my software 3 minutes in, 3 minutes out, because you're sending it from an Excel file or something, creating it into this EDI format, submitting it to the payer or to the other location, getting the results back. And it's truly amazing how it has morphed over the years. And again, how 1,000 phone calls would seem impossible in a few days, where now within a few hours you have the same information back. And again, you now have it back not on a piece of paper with a pen, but you actually have it electronically. And you can now use that for analytics and metrics. And that's my next level of what I do, is to try to take that step for the client, because I wanted to give them the results and be happy with that. But again, now they're coming back and saying, wow, you have expertise in this. I think you should be able to take those analytics and move forward. And certainly with my experience, I advise them on that and give them more data than they expect. Analytics is the future. Data is power. And that's my little thing that I stand on the soapbox with my little sign. Data is power.
I do the same thing with my clients too. They have access to the information. They just don't know how to get it out and interpret it. So that's definitely an important thing. So Peter, I want to thank you so much for joining me today.
Oh, I appreciate it. I enjoy the opportunity to always talk to you and again to your following here and to bring this out to the world, that there is this whole little world that nobody knows about, as you said, from patients' point of view, that helps them have better medical outcomes.
So now I have put your contact information on my playlist, which anyone can find by going to wusb.fm, looking on playlists. Then you find the business of healthcare, and you find today's show, and it should be right there, along with links to all the different things that I'll be talking about through the rest of the program. But why don't you give out your contact information now? Because, there's a good chance that somebody's sitting there saying, I can't wait. I want to talk to this guy right away.
Right. Oh, I appreciate that. Well, again, if you want to talk to the eye doctor, you can reach my office at 631-207-4221 in Patchogue. Or you can reach me at an email address, synchsys, synchsys, @rcn.com. You can also reach our website at ssi-ny.com. Or you can always search me out on LinkedIn, because I'm on there for people that need connections and that type of thing. And you can find a lot more information about me and recommendations and things from other clients to see that if I can be of help to you.